Welcome to today's webinar. County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute. This webinar is brought to you thanks to the contributions of colleagues and partners in Wisconsin and across the nation, with support from the Robert Wood Johnson Foundation. It is produced in collaboration with Healthy Places by Design, an organization that advances community-led action and proven strategies to ensure health and well-being for all. The University of Wisconsin-Madison occupies ancestral Ho-Chunk land, a place their nation has called Dejo since time immemorial. UW-Madison respects the inherent sovereignty of the Ho-Chunk Nation, along with the 11 other First Nations of Wisconsin. This webinar will be recorded. All speakers' views are their own. Guest bios and slides from today's webinar are available on our resource page. We will share a link to the resource page when the webinar begins. Stay up to date on all things CHR&R. Find us on Facebook, Twitter, and LinkedIn. And if you haven't already, sign up for our newsletter by scanning this QR code with your phone's camera. It's the best way to find out about upcoming webinars, our podcast, and our latest tools and resources. Your facilitators today include our host, Erica Burrows-Girardi, with support from CHR&R Communications Specialist, Colleen Wick, and the Collaborative Learning Director from Healthy Places by Design, Joanne Lee. We invite you to continue the conversation immediately after the webinar in our discussion group. Joanne Lee will be our lead facilitator. And watch for a chat from Colleen for details on how to join the group after the webinar.
Welcome to Creating Communities to Support Healthy Aging. Hi, my name is Erica Burrows-Girardi, and I'm so glad that you're joining us today. CHR&R's webinars reflect the values that we hold as part of the University of Wisconsin Population Health Institute. Values of collaboration, integrity, excellence, innovation, inclusion, and courage. These are values that we aim to model during the webinar, and we hope that you will too. And with that, I'd like to introduce you to the team that will be aiding in your learning experience. And I'm going to start with Joanne Lee with Healthy Places by Design. Hi, Joanne.
Hi, Erica, and hello to everybody in our audience. We really appreciate you being here for today's webinar. And we want to invite you to join the conversation and engage with us during today's webinar. There's two ways that you can engage. I'm going to tell you about one of them. One is the Q&A box. So at any point, as you're listening to the content being presented, as questions come up, please go ahead and put them in the Q&A box. I'll be monitoring those questions and we'll queue up the most common ones for our presenters to address at the end of the webinar. Now I'm going to turn it over to Colleen Wick, who's going to talk about how you can engage with us in the chat.
Thanks, Joanne. Hi, everyone. Happy to be here today. Like Joanne said, I will be monitoring the chat, so use the chat to share knowledge or respond to questions that we ask you during the webinar. Please make sure to join us in making the chat a welcoming space by adhering to a few guidelines. So use the chat to share successes, lessons learned, relevant resources, and links, but just make sure to engage in respectful dialogue. As you could see from the way it's popping off right now, our chat conversations tend to be very engaging. So if it's too distracting for you, you could simply close the chat window in Zoom. Also, please know that views expressed by speakers and participants are their own. They do not represent CHR&R or Healthy Places by Design. Again, if you have any questions for the panelists, please use the Q&A box as Joanne described. And now I'll pass it on to our technologist, James.
Hello, everybody. I'm James Lloyd, and I work as a technology coordinator for the County Health Rankings and Roadmaps, and I'm acting as technologist for our webinar today. So if you have any type of technical issue that I might help with, reach out to me in the Q&A box. That's the best place where I can respond and track a conversation. And I just want to make sure that everybody has a great experience with our webinar, and this subject today is fantastic, so I really appreciate it. And I'm handing it back to you, Erica.
Thank you, James. I couldn't agree more. I'm really excited about this topic, and Thanks to the production team for always making our webinars just excellent. Many of us have heard the term healthy aging, I should say. But let's define what we mean so that we're all on the same page. The Centers for Disease Control describes healthy aging as a process of maintaining good physical, mental, and social health, as well as good like well-being, just feeling good, just being well. And we do this as we grow older. And healthy aging starts at any age, not, as we are just approaching retirement or thinking about, oh, what's that next stage in life? No, it happens at any age. And did you know that in the next decade, adults over the age of 65 will exceed the number of children in the US? So, in order for us to thrive as we age, we must create healthy, age friendly communities that support our health and well being over the life course. So, this looks like passing policies, implementing environmental changes, changing the way we do business, like shifting institutional practices and funding streams to prioritize healthy aging. And here to describe how public health can create age friendly communities are policy experts Megan Wolfe and Karon Phillips, both with Trust for America's Health. Hi, Megan and Karon. How are you today?
Hi, Erica. Doing really well. We're so happy to be here and be able to share some of the work that we've been doing around the country with our national partners and with a lot of folks that are on the call here today. So thanks for having us.
Thanks for having
And
us.
yeah, thank you. So, to learn more about our guests, make sure you read the guest bio on the webinar resource page that Colleen has chatted out. And following my interview with Megan and Karan, we'll share a brief video featuring Mariah Hayden and New Life Village, which is an intergenerational residential community in Florida. New Life Village has been intentionally designed to meet housing needs for older adults and for children in foster care. So I can't wait for you to learn more about this amazing community design. And of course, we are going to have a discussion group right after this webinar so you can unpack what you'll hear today. Please plan to join the discussion group and just continue the conversation. So during the video intro, you heard about our groups that follow the webinar and they're facilitated by Joanne. They're always engaging. They give you the opportunity to share with and learn from others. So look for a link that Colleen will chat out at the end of the webinar so you can link to the discussion group. And then look for this webinar's resource guide that's going to include links from CHRNR, links our guests have shared with you, and relevant links that are shared will be shared by your peers in the discussion group. And that resource guide will be in your inbox before the end of the week. And with that, Megan, I'd like to start with you. What is Trust for America and what do you do?
So Trust for America's Health, or TIFA, as we're commonly known, is a public health nonprofit, nonpartisan organization. We're based in Washington, D.C. Our focus is really ensuring that the public health system is strong, is structurally sound, has funding, and is focused on emerging issues. And so to do that, we do a lot of advocacy. We have a very strong government relations team. We also produce reports, and a couple of them that you see on the slide here, our Ready or Not report that focuses on emergency preparedness, and it actually provides a set of indicators for every state and how they're doing and how well that they are prepared for public health emergencies. And then most recently, the middle document you see is our blueprint for strengthening public health for the next administration and Congress. And that is a set of recommendations that that we will be providing to Congress and the new administration as they begin their work and kind of ramp up. That was produced in concert with a lot of our public health organizational partners, so we're really proud of that document. Our healthy aging work is relatively new, and by that I mean we started it about 2017. So about 6.5, 7 years ago, but it's really grown a lot. So we're really happy to be able to share that today.
Yeah, thank you for kind of sharing the scope of the work that you all provide and how you um, help support the work that we do in community health improvement work. Why should public health elevate healthy aging as a core public health function?
So public health addresses health across the life course. And yet, historically, we've seen that many public health departments and practitioners really are focused on early life, so maternal and child health, and that's good. It's right. It's where we need to focus. But as we are looking at longevity, and we always say that longevity is a great story. This is a public health success story. Public health has contributed to longevity, right? With vaccinations, clean water, clean air, seatbelt campaigns, anti-tobacco. And so as the population, the older adult population is growing, their needs are growing. And sometimes those needs are complex, but public health has many roles to play. So we believe that, as we have elevated maternal and child health, we have to think about healthy aging all through the life course. And so we have to be thinking about the older adult population as well. So we really feel like this should be made part of what public health departments do, what the public health sector does.
Yeah, I just want to say thank you for reminding us that public health has contributed to, lives and the length of life that we are experiencing.
Yeah,
Yeah.
absolutely.
Now, as we grow older, we're also growing more diverse. So share a little bit about that.
Yeah, so it's interesting to think about, the older adult population is just getting bigger, but also we're seeing that the number of Hispanic older Americans, Black older Americans, these populations are rising even faster than the white population, and so we have to think about that and kind of incorporate that, thinking about health equity. When we look at the racial, ethnic, and socioeconomic disparities that happen early in life, if those aren't addressed, they will grow and accumulate over the life course. So those disparities and the impact on the health of older people who have been dealing with those impacts throughout their lifetime can actually be more complex and worse. And so this is why we like to point out this growing diversity, which again it's good. It's a success story, but it does also it's important for us to be thinking about what can public health do. Do we need to track? We need to track the people where they are and think about the interventions, and even thinking about how we approach communities of older people who may not speak the same language. We have to make sure that we have trusted messengers who are going into these communities.
And I know here you're sharing what different ways that we see how public health has contributed to longevity. Talk
Yeah,
a
so
little bit
these
about this slide.
Sure, these are some of the areas that we have encouraged state and local health departments to become involved in, and I think later Karan can talk about some examples of some of these. But these are kind of like um, very, very obvious, in some cases, very obvious areas for public health to engage in. Of course, preventive services are some of those things that we think about, blood pressure screening and diabetes screening and some of those things. We need to make sure that we're incorporating older adults in those, thinking about housing and transportation. How can you partner with other organizations and agencies in your community to expand access to those services for older people? Supporting family caregivers. This is National Caregiver Month, so there's a lot of attention being paid to caregivers, but there are ways that public health can support caregivers as well. Of course, nutrition, physical activity, and that includes balance classes. Thinking about emergency preparedness for older people is a very unique place for public health to intervene and to strategize, because the needs of older adults and their caregivers, if you think about like an emergency needs shelter, emergency need shelters need to make sure they have room for caregivers, and to think about durable medical equipment that needs to be brought into those shelters. When we're thinking about heat and heat related emergencies, older people, our bodies may not be able to process heat the same way, and medications may impact that as well. So these are all considerations for older people that we have to think about. Then, of course, rural health challenges can be unique, thinking about social isolation. And I know Healthy Places by Design has done some great work around that area. And a new area that we're working on is elder mistreatment prevention, and hope to have a chance to dive a little bit more into that in just a little bit. But yeah, these are the areas that we really feel like public health has great opportunities to support.
Yeah, and it's core to the work that we do. So thank you so much for sharing that. Um, Social isolation, back to what you were saying about healthy places by design. I want to just kind of cue our participants to hear about some ways that New Life Village is addressing social isolation. And you'll see that when we listen to that clip from Mariah Hayden later on in the webinar. So there is what Tifa has described as an age-friendly public health system. Can you define that for us? What is that?
So it's going to look different from jurisdiction to jurisdiction, because as you all know, if you've seen one health department, you've seen one health department. And so we have there's some characteristics that we point to, that we feel like if you can get all these things in place, that this will be an ideal age-friendly public health department or public health system. One is leadership. There really needs to be someone who has taken these issues on and is championing them, and will help to make some systems change to make sure that they're sustainable. Another one is dedicated funding for healthy aging. That's a tough one, because a lot of times public health funding is categorical, it's disease specific. So thinking about healthy aging writ large, that's sometimes a challenge. But if the state or community health improvement plan prioritizes healthy aging, even if there are just a couple of areas within that plan, that's a really good step forward. Collaboration across all agencies. In some places in New York, they call that healthy aging in all policies. Healthy aging in all policies, which is unique, I think, to New York. And then having data. There are not a lot of, especially at the state level, health departments that have a comprehensive data dashboard on older adults. So tracking things like falls, emergency department visits, prevalence of Alzheimer's and related dementias, those kinds of things. A lot of that is in the CDC BRFIS. Some of it's in a number of different places, but it's incumbent on the health department to bring all that together and have it in one location for easy access, and then emergency preparedness planning, which should include older adults. So this is kind of what we think about when we think about what should an ideal age-friendly health department have. These are the kind of main areas that we think about.
And as people begin to think about creating an age-friendly public health system, what other sectors or spaces should be involved in that ecosystem of an age-friendly public health system?
So age-friendly public health, healthy aging by itself, I mean, public health, no sector can do it all, right? We've learned that collaboration and coordination across agencies and sectors is really important. We're seeing that throughout states that are working on what we call multi-sector plans for aging. Those are happening in about 50% of the states right now. But this means that your public health department is coordinating with the healthcare systems in the jurisdiction, and maybe they're aligning around their community health improvement planning process. Thinking about workplaces, and are your workplaces and our businesses age-friendly or dementia-friendly? Thinking about coordinating with the Aging Services Network in a jurisdiction, the area agency on aging, the AAA, or other community-based organizations that provide those direct services for older adults. We saw during COVID, a lot of places in Florida where we worked early on in 2018 and 19, that where the health department and a AAA already had a a really solid trust-based relationship. They were able to deliver vaccines to people who are homebound very quickly because the aging services people knew where people were located, and then the public health department could help coordinate vaccine delivery. So that's what we're talking about when we're thinking about this ecosystem and partnering across sectors, is really thinking about who are the other partners, who are the other actors, you know, in your backyard that you can connect with to improve services and access and lives for older people.
Yeah. So you all have created a framework, and I wanted to know if you could share a little bit more about the framework that Tifa developed for for creating an age-friendly community, like, and then who can like use the framework.
Yeah, sure. Thank you for asking. This is the basis for everything that we do. Is our we call it our 6 C's framework for supporting healthy aging. It originally started, interestingly, with only 5 C's. And then over the first few years of us using the framework, we added the creating and leading change, policy systems and environmental change, because we came to understand how important it is to have that champion, to have that leadership. But these are basically areas that kind of outline where public health can begin to act. It's not prescriptive. It can be very flexible. And we're hoping that the framework, and we've seen that this framework allows public health practitioners to see their work in a number of these different areas. So in creating and leading change, in connecting and convening, so that's really advancing partnerships, in coordinating existing programs, you know, efforts that are already happening, they may be a little disjointed. Public health can come in and help coordinate that. And of course, that data component, collecting, analyzing, and sharing data, communicating important public health information. And when we talk about communicating, it is communicating with partners and with policymakers, but also creating those communication tools for older people in the community that need to know about public health and other programs that can benefit them. And then coordinating and complementing services. So all of these different the 6 C's are really about roles and where we hope public health departments can begin to see themselves. And this is also the foundation for our recognition program that I know Karon's going to talk about.
Yeah.
And when you ask who can use the framework, really anybody, any public health department can use the framework. And we're also encouraging non-governmental public health organizations to think about this framework and how they might be able to see themselves in it and begin to take those steps. Because this is really, you know, a way to think about, what can I do? What are those first
Right.
steps I can take?
I love that. Yes. Yeah, Karan, Megan set you up well. So yeah, you did, and you all have created what you all call APHIS, which is the Age-Friendly Public Health System Recognition Program.
Mhm.
Share a little bit more about the recognition program and tell us, what does it celebrate?
I love that you call it celebrating, so because that's exactly what I like to say. It's highlight, honor, and celebrate the work that state, local health departments are doing. Also, public health organizations as well. And I'll explain and expand share the process. But it's again incentivizing state and local health departments to make healthy aging a core function of their work. And again, the goal is to help them build knowledge and capacity around healthy aging and supporting older adults, and we do that by providing technical assistance. Megan and I enjoy talking to state and local health departments and other public health organizations that are interested in supporting healthy aging work. And again, this work, once we know about it and are aware of it, we highlight it, we recognize it, we discuss it. As you'll see in the next coming slides, we talk about how great the work is and how this helps provide different opportunities for connection, and it links back to our 6 C's as well. And a lot of this work also, there's work in our monthly training series. So we have a monthly training series every third Thursday of the month at 3 p.m. Eastern Standard Time. And again, this is to help also build up capacity of these local health departments and state departments and anyone actually that wants to attend. And we this year we're focused on equity And so we've talked about combating ageism. Actually, every January we talk about combating ageism. We also have talked about social determinants of health, social isolation, um, and a wide range of topics. We have almost 4 years worth of content on this. So again, we use these trainings as an opportunity to build capacity and help the interested vested parties understand
Yeah.
and build up their expertise. So these are our 3 levels, and I'm very excited to talk about these because we have opportunities for almost everybody to get engaged with us. So the first level is the Department of Health recognition. So again, this is for state and local departments of health. And how this is achieved is we have an action plan. And the plan is based on the very framework that Megan just shared on our 6 C's. So what happens is you complete and list out activities that you have either completed or that you're planning to do related to healthy aging. And they all fit in again with the 6 C's. And the reason why we really like this framework and using the action plan is because, again, it's going to look different. Everyone's action plan is going to look different. The activities everyone is doing is going to look different. Again, it also accounts for rural context, urban context, race, ethnicity, all different kinds of things can be shared in the action plan. So it's an opportunity essentially to brag on yourselves and to highlight what is being done. So again, that is the Department of Health recognition that is at the state and local level. And then we have our newer, we've expanded to allow public health organizations to become recognized. We recognize again that there is work being done at public health institutes. There's work being done with state public health associations. We also have national level organizations. The Association for State and Territorial Health Officials is a recognized organization through our recognition program. So again, same process of identifying what exactly are you all doing or have done that highlights the work related to healthy aging. So those are the 2 high level organizational level, department level recognitions. And then we have the individual recognition. This can be anybody, anywhere, anytime, actually. And I say anytime because you could decide over Thanksgiving break that you want to become an APHIS champion, and we would welcome that. As I mentioned, we have 4 years of just about 4 years of videos that are available for viewing of our content. If you view 6 of those trainings, whether it be if you attend our live training on the 3rd Thursday, or you view 6 of these videos on YouTube, you can become an age-friendly public health systems champion. And again, this also is to elevate the individual capacity and to help elevate healthy aging. Some people have used this to bring healthy aging as an important awareness or important topic to their organizations and to help elevate the issue. So that's how some people start, with just the individual recognition. There are students in public health programs that have also taken up becoming individual champions, and then individuals in the community also have done that as well.
Right.
So those are our
Yeah, I
3
was gonna.
levels.
Yeah, I was gonna ask you, would this be maybe an entry point for people who are themselves are older adults who might want to have an interest in helping to build community supports for aging?
And
Yeah,
I will share, I've had family members attend some trainings before. So there's
yeah.
definitely opportunity there.
Well, can you share some examples of innovative policies or programs that have come out of this work, out of creating the age-friendly public health systems?
Absolutely. So this is again one example of a program, or I should say, a state that has achieved state level recognition, but also has used that to catalyst and expand on their work. And we actually have an update that we received about them today. But the Tennessee Department of Health, under the leadership there. They started with their state level recognition. So again, their state level Department of Health is recognized, and then they have expanded. And their goal is to have all of their local departments of health as recognized. So again, they're aligning all of their work, not only at the state level and the local levels, around healthy aging. And they're doing this by collaborating. And Megan and I are presenting to them and sharing and helping them understand and see how their work intersects and is a part of supporting the health of older adults in their community. Tennessee is very unique in that there's a lot of rural area in Tennessee. So they're again really thinking critically about how they can support not only older adults, but older adults that are in our rural areas, and they experience unique, I don't want to say challenges, but there's some unique context that needs to be considered in that as well. And they're also deeply committed to equity. I know I'm going to talk about that also a little bit later, but they're also really focused on addressing and promoting equitable strategies in their approach. So they've also recently developed an equity toolkit that they are also promoting. And again, they've been holding stakeholder meetings, and they have been engaging with different sectors to bring them all in to have these meetings to, again, bring healthy aging to the forefront. The update that I will happily share is that they recently just officially changed, and they have a specific office in their Department of Health that is the Office of Healthy Aging. And that was a direct reflection of their commitment to the work, but also their leadership in their state as well. They're very committed to it, and that is an exciting update that we're happy to share that they just announced yesterday. So we're excited
I
about.
love that. That's a shift in an institutional practice to
Yep.
support age-friendly communities. Love that. Thank you for sharing that update. And what
And
happened in Wisconsin?
I love the story in Wisconsin. They got together, and they actually brought together older adults as well in their community, and they did a walking audit. And this is something that the AARP cities and communities recognition, that's something that they are familiar with. And so they looked around their neighborhood, they looked at what was available and looked at how they could improve the community for older adults. And they applied for and received um, a challenge grant from AARP to add walking maps and wayfinders and more benches around their community. Again, they truly connected, involved everyone at the table. So this was led by the Department of Health, but again, older adults were a part of this. And again, this is a simple changing of their physical environment, but again, it was a meaningful change that was a thoughtful process as well.
And actually helps everybody. And so I
Yes.
love that. I mean, everyone can benefit from having benches where you can
Mhm.
rest or even enjoy nature and, the maps and all that. So, yeah. And I also
Mhm.
love the fact that you said it was simple but with a large impact. So I
Mhm.
love that.
Mhm. Mhm.
Yeah. Now, I want to talk about some systems change because we talked a little bit about changing some policy, changing institutional practices, but we also want to address systems. So, what are some innovative systems that point to equity that you've seen with this work?
So talked about Tennessee a little bit, but want to talk about what happened in Florida. So Florida has, to our best knowledge, and we're pretty we have not seen any other ones, has the most comprehensive data dashboard that not only encompasses health conditions of older adults, but it also recently was updated a few years ago to include race and ethnicity, so they could really understand and look at disparities in the state and look at some of the unique challenges at the county level. So it's not just statewide, but they can really look at, well, in Alachua County, this is something that's happening that may not be the same as Hillsborough County. And so again, it's really important when you're developing um, plans and looking at older adult populations that you not only think about the unique health conditions, but also some of the unique racial and ethnic makeup of these different counties as well. So they have the most complete data dashboard that, again, is constantly updated with current data that looks at
I'm going
race
to
and
share
ethnicity.
some of the data types of data
Mm-hmm.
that is that they collect with their dashboard. Let me
So
go
you can
back to
see
this.
in the nearest supermarket, really getting at looking at food deserts and food swamps. Again, making those connections. But again, it's important to understand so you can think about not only with your um, partner development, but also your program development as
Right.
well.
And again, this is meaningful data for other people as well, because if it's a food desert for a certain age population, it's a food desert for a younger
And for
population as
everyone.
well.
And other states are developing data profiles. So Florida has a dashboard, but we know Mississippi has data profiles, and they have uploaded theirs into a platform that can be utilized in the same way. Again, the goal is to be able to capture accurate information and to be able to share that with partners and aid in partnership development. So Mississippi has data profiles, Washington State has data profiles, and again, other states are looking at how can we get access to this information so that we can also have these meaningful opportunities.
Right, right. You can't make decisions with decisions that, or even find strategies that work without
Mm-hmm,
the data. So,
mm-hmm, mm-hmm,
um, so I know that the frameworks are helpful, Karan. So thank you for the frameworks. But we still see, sometimes frameworks can oversimplify, challenges and stuff. And we see that there still tends to be like some structural barriers or challenges that community groups have encountered when they try to change a system.
mm-hmm.
So, what are some of the challenges that people could anticipate so we can help them figure out a way to overcome them? How could they overcome those?
And I'll try to frame, how some places haven't been able to address it, but leadership buy-in is important, and I think that as departments of health, when we launched our recognition program, it was actually during the pandemic, and so while we were excited about this, and many again departments of health were excited about it as well, their priorities were shifted onto vaccine distribution, COVID management. So leadership buy-in is very, very important. Making sure that they see themselves in this, but leadership buy-in is definitely one key area that can be challenging. If you don't have the support from your leadership, it can be challenging to make a system level change. Sustainability. That relates to a lot of things. People transition from different workplaces. People change up the structures of their organizations, sometimes for the better, sometimes restructuring means a program no longer exists. So who is going to be able to lead that initiative? Who's going to be able to take the mantle and continue with the work? Cross-sector understanding. So there's a little bit of turf battle. So who owns this, or not even own it, but well, this is our work. We don't want to lose funding if if we're working, if you're doing the same thing, figuring out where things belong. Again, who gets credit? So sometimes a bit of turf battle and understanding where things belong, and even working cross sectors. And then related to that is the issue of silos. Historically, public health has, again, we already demonstrated public health has done a great job of supporting us through the life course, but they don't necessarily see themselves as being part of the work to support healthy aging necessarily. So again, operating here, and they say, oh, well, that's what our aging colleagues do. We don't really do any work in that, but helping bridge those silos, helping break down those silos, I should say, is something that is important to do. And then funding. Although my colleague in Mississippi, Dr. Keenan White, would argue you don't necessarily need funding, you need creative collaboration, and there's opportunities, but funding is a reality, and
Yeah.
some things cannot be done without the appropriate level of funding to achieve these goals.
So how do we manage those challenges?
I think, and I'm going to base it on some of the examples, but some of the challenges are simply having conversations. So in Florida, where one of the first meetings occurred related to this, the director of Elder Affairs and the director of Public Health had not met each other, and they were working in the same building. So sometimes it could be a simple conversation of understanding this is what we can bring to the opportunity. This is what you can bring to the opportunity, leveraging that. There's also opportunities in the multi-sector plans, or some are called master plans on aging. Again, these are being led and they're designed to be collaborative. There is a role for public health in this. There's opportunity for public health to be involved in development of these plans. And again, they're supposed to be multidisciplinary to help bridge all these different connections together to support older adults. In the different community health improvement plans, there's an opportunity to make sure older adults are there. Community health improvement plans happen. They have to happen. There's opportunities to sync up with the state plans on aging, seeing where there's some intersections there, seeing where there's opportunity again for collaboration and coordination of services and resources. So that is also a part of the process. We also know that the collective impact process is another strategy. having open communication and looking for some common agenda items. Again, this is an official strategic process that departments can undergo, organizations can undergo. But again, figuring out where the intersections are, figuring out, again, there's one of my favorite words, data, resides, and figuring out where the mutual interests are and align in that opportunity.
Yeah. Yeah. Thank you so much, Karan. We're going to circle back to you in a second. But Megan, I want to ask, how can community leaders and public health practitioners start the process of working with you all to
Thanks,
create
Erin.
these systems?
Yeah, thank you for that question. It's a question that we do get quite often. It's like, what can I do? So, of course, Karan and I would hope that people would start by becoming an APHIS champion. So, attending our monthly training series, which really is a professional development opportunity. It's a capacity building opportunity. We bring in speakers from national organizations, from state and local health departments, from experts on a number of different issues. You can go back and look at our YouTube site, which houses all of the trainings to pick a topic that you're interested in or that you know you want to address. So that's one way. Another is just to, as I said earlier, look and see who's in your backyard. Who is who's doing work in aging? Is there a AAA in your community? Find out what they're doing. Just kind of, pick up the phone, go to a coalition meeting. There are a number of ways to just find out what other folks are doing in your community. And then another way to do it is to think about all the programs and services within your department, your agency. Are any of them connected to healthy aging? Which ones are touching older adults? Where are those touch points for older people that you can think about expanding? And then, as Karan said, the community health improvement process is a huge area for beginning to not only think about older adult health, but bringing older people into the process, into those focus groups, because we're doing, we're creating programs and interventions for people. We should be hearing what they want and what they need, and really, focusing on that. And then I had one more idea that completely just skipped my mind, but hopefully we'll circle back to that. But
No, we'll have time because we'll have you
okay,
in the discussion group.
all right, sounds good. Yeah,
But
those are
yeah,
some places to get started.
that community health improvement planning process is a wonderful way to hear directly from people that are in this process and they know what they need and they can share what they need to all of us in public health. And there's some resources, lots of resources that you have on the your APHIS site that I want to make sure that people know about. So thank you so much for lifting those up. And then thank you for sharing your contact information for how ways that people can get involved and stuff like that. So we appreciate what you brought to the discussion. We're going to circle back to you in just a moment with questions. So thank you so much, Megan and Karan. Next, James is going to air a short video featuring the executive director of New Life Village, a residential community in Tampa, Florida. And the executive director is Mariah Hayden. And New Life Village is possible. Hold on. New Life Village is possible because a lot of the things that Karan and Megan were talking about, the partnerships, the process, all of that happened through this, the creation of this intergenerational residential village. Now, unfortunately, Mariah couldn't be here. She couldn't join us live today, but I did interview her. And so we're going to include a link to her, that interview in the resource guide. But in the meantime, I encourage you to watch this excerpt and then check out the full video later. So thank you so much, James.
And here in Tampa, we have an affordable housing crisis, and we also have a foster care crisis. So anybody that can live in our apartment complex would need to be positively impacting foster care. So they need to be removing children from foster care or preventing them from going to foster care, which is often grandparents and relatives to children. Is we have senior citizens that live in the village, and our seniors serve as surrogate grandparents, tutors, mentors, communal neighbors to these kids who've been impacted by a lot of trauma, a lot of displacement. And so we have 52 homes, about 160 residents, 110 children. And every day we village. It takes a village to raise a child, and all of us are working together to live together, to serve each other, to serve the mission, but with the ultimate commitment to the children in this community feeling safe, stable, and having the opportunity to heal. All of our children have been removed from their biological parents. So just in that of itself, being taken away from living with mom and dad is highly traumatic. Then you add to that circumstances around the removal. So that's more trauma. Then you're placed in foster care. You're possibly moved to multiple different homes in foster care. Trauma, more trauma, compounded trauma. So when children come to New Life Village, they're coming with their grandparents who now are taking permanent custody of them. They're coming with a foster household that is hoping to adopt them, or they're coming with an adoptive family. So there's different types of families that the children move in with. But the first step is for the children to have stable and safe housing, to know, okay, I'm going to live in this building, in this community, and it's going to be safe and it's going to be stable, because you really can't think about healing trauma, thriving, doing well in school, are you going to college, any of those things, until you have that safe foundation of housing. So that's the first thing we provide to our children and the caregivers caring for them. But then the senior citizens, they are here in what's called intentional retirement. So that's a concept that AARP has done some work on. And it's basically where senior citizens are saying, hey, I want to retire, but I want to retire on purpose. I still want to have something to do, something to provide, something to give forward. So all of our seniors that live at the village are here in intentional retirement. The homes that they live in, there aren't children in the home, so they aren't raising the children, but outside of their day-to-day lives, they're helping, watch the children when they get home from school, tutor the children, wrap around the children, do different events with the children, give the caregivers a break. So the caregivers might get to go grocery shopping, and the seniors like, look, I'll watch them for a couple hours, or I'll give them a ride. So our seniors are wrapping around the children in the community, which gives them purpose, but also helps the children in the community, because they have this grandparent, actually multiple grandparent figures in the village who are there for them and supporting them.
Thank you for sharing that. Thank you for sharing that, James. And be sure to watch the entire interview so you can learn more about the system that Mariah and her crew created there in Tampa. And we also encourage you to check out these What Works for Health evidence rated strategies as you deepen your learning around this topic. And as a reminder, County Health Rankings and Roadmaps What Works for Health database contains about 400 strategies to support your community health and improvement needs. So check these out. Of course, they're going to be in your resource guide. And so with that, I'll just pause to see what questions may have arisen. Joanne?
Thank you, Erica. We have some really great questions from our audience, so definitely want to welcome Megan and Karan back to the cameras so that we can address as many of them as possible. You definitely got people not only thinking about the importance of supporting age-friendly communities, but also thinking about how can I do it. So I will let you both know that we've gotten multiple requests for how to get involved with the training. So we're going to want to get that link from you about how they can get more training information so we can put that in the resource guide. I'm going to start with you, Megan. And Ginny wants to know if you know of any resources to assist state planning in addressing aging population emergency preparedness that could benefit rural and agricultural communities.
So interesting, thinking about emergency preparedness in rural communities is very unique, right? And I think that this is an area where there aren't a lot of resources yet. But I do feel like there are some things to think about in terms of what are maybe some data sources that you can look at so that you can identify who the people are in your community. There are really important partnerships to develop to identify the people in your community, and who else is working on emergency preparedness, whether it's the local emergency management team or system, whether it's your local faith community potentially, whether it's your senior centers, and how are they equipped potentially to deal with emergencies, and can they house people? Are there shelters in rural areas where if people need to go to, if there's a tornado or a fire or a weather related emergency? It's really finding out what are the resources in the community. I think that there is an effort underway at CDC and some other federal agencies where they are developing some plans, and we have contributed to that work and are hoping that that's happening, but it's not there yet. I do recall, however, Karan, what was the name of the organization that we presented at a couple weeks ago? The National Agency for Seniors and Disasters, something like that.
Yep.
So there are some resources there that I recall. I don't have them at my fingertip, Joanne, but and Jenny, I'm happy to look those up, and I can send you those links after the conversation today.
That'd be wonderful. Thank you so much. I think another thing is to think about maybe recent crises, natural disasters, and look at who the formal and informal helpers were and start to build relationships with that. It's amazing. I live in North Carolina, and when the hurricane went through Asheville, there was, yes, a lot of formal infrastructure and agencies, but a lot of informal organizations and partners and people that helped.
Yeah,
Wonderful.
after one of the hurricanes in Florida, Charlotte County did an amazing thing. The Charlotte County Health Department led this. So they brought all the agencies that could potentially contribute to thinking about recovery and resilience, and brought them to a big parking lot, right? And so they had mental health services, they had housing, they had transportation, they had clinical services, and they were all there. And one thing that we heard yesterday in another conversation was the importance of having a navigator or a coordinator just to help older people navigate those lines and figure out how to, which service you
Yes.
need to access. Because some people
Yes.
may not be able to stay in line for the whole time. So they really need some help with that.
Thank you. Well, let's get on to more questions. And I'm going to have Karan start with this one. This one's from Indu. Can you give some examples of collaboration between public health departments and health systems that both, participating in the age-friendly initiative that you spoke about?
I think the example I always refer to is Mississippi. They started, the Mississippi Department of Health started with their age-friendly public health system recognition, and they used that recognition in partnership with their colleagues at AARP to then expand and develop their own ecosystem, if you will. And that's what we're calling it that, and that's what they call it as well. So they have, I do believe it's now 2 or 3 age-friendly health systems in their area now, as a result of collaborating and using their designation as a catalyst to help expand their reach and their work with engaging with hospitals in the area. And I will also add, even though you didn't ask, I'll further add, they also are working with universities in their area. So now they have, I think, 2, it might be 3. Every time I ask Dr. White, the number changes. Universities, so they now have age-friendly universities as well in the area. And they already have they have about 5 or 6 AARP designated communities, and they're working on getting and establishing employers. So age-friendly employers is not officially, it is a designation. It doesn't have a place that it lives per se, but they had a panel actually it was earlier this year, where they invited members of the Chamber of Commerce to come in and speak about some of the strategies that they're using to stay connected with the policies, or not policies, but the practices related to age-friendly employers. So Mississippi is probably one of the best examples.
That's
I
great.
always refer to, where they're engaging with the entire ecosystem and building out their own state level ecosystem.
Hmm. And when this question was focused on healthcare systems and public health, I just want to remind folks about the power of the community health improvement plans and community health needs assessments, because those are always done in partnership with the local nonprofit hospitals and the health department. All right. Here's Alice wanted to know about the role of community health workers. Have either of you seen some specific roles that community health workers can play as part of maybe the workforce development component, but also supporting age-friendly communities?
Yeah, there's a couple of examples of that. One of them is some work happening with the National Rural Health Association. They're building out an age-friendly project, and so they've done trainings with community health workers who work specifically in the community with older people. And the trainings are bilingual, so that in certain communities in Texas where people may only speak Spanish, so community health workers are going in and helping to navigate health services specifically for older adults. So that's a really cool project that's happening. And then there again, back to Mississippi, they are engaging community health workers and others in the community to build age-friendly ambassadors. So these are folks that go out in the community again and work with older people to make sure that they have access to the services that they need.
Wonderful. Um, Karan, there's a very specific question about the recognition program. Um, how long is the recognition good for? Is it something that communities, individuals have to re-up every so often?
No, it is once you receive it, you are recognized. There is no re-up, there is no need to redo it. Although we would encourage you to still keep coming in and joining us for our trainings. I think there's some people, honestly, we could give them another certificate because they keep coming back, and we are constantly trying to make sure our topics are relevant and very timely. So again, there's no recertification process, if you will, and even for the state, local, or organizational recognition. But Megan and I are also always available. We did have one, and actually we're not opposed to this. If your action plan consists of activities that are planned, and then you move into the phase of you have completed them, you can move to an advanced recognition within your recognition. So we do encourage that. We've actually seen that happen a couple of times where departments of health have come back and said, "Hey, we've done this, so can we move up to the next level?" And it's fun to see people excited about completing their plans and their action steps.
People are very motivated by recognition, so it's a beautiful model. Thank you so much for answering, to both of you for answering so many questions. Erica has joined us back, so I think it's time to move on. Turn it back to you, Erica.
Thank you so much, Joanne. Don't forget, Karan and Megan will be joining us in the discussion group. So we want to make sure that you join us so you can continue the conversation. Plus, I want to hear about the things that you all are doing in your communities. So please be sure to complete a brief survey that Colleen is chatting out the link to now. We love hearing from you. It helps us improve our webinars, and it really is one of the best ways that we learn about what your learning needs are, what you have an interest in. So please be sure to fill that out. And in just a few weeks, we will be joined by Dr. Bonnie Sweener and Kimberly Tussaud. They are both passionate advocates for the disability community. I learned something new this week when I was preparing for this webinar. Over 60 million Americans live with a disability. So, in this webinar, we will discuss how data, policy, and again, those institutional practices that are so important can be shifted to maximize accessibility and inclusion for all. So, I hope to see you on December 10th. Again, please plan to join us for that discussion group. Colleen is chatting out a link to the discussion group right now. And again, that is an opportunity for you to hear and learn from others, share what you're doing in the community, and then spend a little bit more time with Megan and Karan to maybe ask additional questions or find out a little bit more about the work that they are doing. Lastly, I want to invite you to stay connected to us. The best way to learn about our webinars and resources is to sign up and subscribe for our newsletter. But we also have a presence on social as well. So please stay connected with us. And I want to thank you for all the hard work that you do in your communities to create equity. And I want to thank our production team for all the work they did. Thank you for Megan um, Wolfe and Karon Phillips for sharing their wisdom with us today. And I look forward to seeing you next month.